So today we are talking about the importance of making sure we're uniting sectors, especially in crisis settings in this specific time period where we're facing a really interesting global context, in a moment where countries are turning inward, in a moment where we're seeing increased conflict and crises. Even just thinking about the news every day, it's hard to not think about the impacts that all of this are having on children and just the world we live in. And so we're really excited for this webinar to think through some really practical solutions that we can drive our advocacy forward with when it comes to integrating nutrition in early childhood development in crises, and just the importance of having more cross-sectorial coherence when we're engaging in crisis settings to ensure children have everything they need to survive. So a little bit about us. We're Results Canada. My name is Lindsay Sheridan. I'm the manager of advocacy at Results Canada. We are based in Ottawa, Ontario, and it's early in the morning for us, but we are a nonprofit, nonpartisan, grassroots advocacy organizations, and we mobilize everyday people to generate the political will necessary to end extreme poverty. So we actually don't do any programming. We work with our volunteer advocates and partners around the globe to leverage resources and policy change in global health equity, access to quality education, and economic inclusion. And we don't do this in a silo. We actually are part of something called the Action Partnership, which has offices across the country that engage in global health specific work. And so they help feed our engagement and make sure our policy asks. We also work with global alliances and coalitions like the Moving Minds Alliance, who we're joined with today, to engage and make sure that we're building global positioning around advocacy that's really important and going to have the greatest impact for children. And so what we're focusing on today is the state of nutrition, but also the importance of integrating nutrition within crisis settings through ECD programming. So I want to set the scene before we get started. This is going to be an interactive webinar. You're going to hear from a great panel, and then we're going to do some really important collaborative work together where we're going to be essentially ensuring that we're going to have a call to action that results in this so that we're pushing our advocacy forward and can have a collective impact together. So many of you will already know this information, but I wanted to do some scene setting before we get started. We know that conflict and climate are driving rising malnutrition. We know that most of the children who are wasted and stunted live in crisis settings. And actually, there's been a 20% increase in acute malnutrition in crisis settings. On top of that, we're seeing 468 million people affected by conflict and displacement, with this number set to rise in 2026 with the increased conflict and war happening around the world, and that's been kicked off even in this year. We also know, unfortunately and startling, that nearly half of child deaths under 5 are linked to malnutrition, and we, for the first time ever, are seeing a rise in infant mortality for under 5 children. And so these are staggering statistics, and we have to be reminded that these represent children and something that we do have the power to change and ensure that we live in a world where this doesn't happen again. On top of that, we know that 146 million children are affected by stunting, and we do obviously have the tools here and available to ensure that this doesn't happen. So today with the webinar, we want to try to think of different ways we can work together across sectors, across the fields that we engage in, to ensure that we're going to have impact and try to catalyze support to change some of these stats. So with that, as many of you know, the Nutrition for Growth Summit was hosted by Paris last year in France, and this was a global platform to drive commitments of financing for nutrition. This was disrupted in 2020 due to the pandemic, so we already did see a kind of downward spiral in terms of donor funding at that level. But at the Nutrition for Growth Summit just last year, $30.5 billion in new financing commitments have been registered. And we were happy to work with MMA and a host of others, some who will be presenting today on the call at an event there, to really kick off this conversation on how we need to continue to embed ECD programming within nutrition programs for crisis settings so that children have access to everything they need to thrive from the early years onwards. And so this webinar is building off of that, but even opening it up more to try to create the intersectoral support and commitment together so that we can have new approaches that will have impact on the ground and in communities at different levels. So as a part of the work results Canada has done, we did an analysis on specifically the N4G pledges that have been listed online in the annex, and then did an analysis further that identified crisis settings, children in the first 100 days who live in humanitarian or resilience. And we really found some of these were our top findings. Actually, in the last N4G, there was a shift towards lower and middle income country leadership and a decline in high income country leadership. So this is something that's interesting to see, that there are more countries stepping up while high donor countries are declining their commitments. And we're seeing this with countries like the United States, for example, cutting USAID and cutting aid around the world. And so this does have an impact in spaces like N4G. There was a larger specific focus on systems and resilience, but the interesting piece to this is it didn't necessarily transfer to intersectoral approaches or coherence. So there is a risk of missing key developmental outcomes when we're not programming coherently across that space. And another thing that was interesting, and one of the reasons we're on the call today, is there was limited explicit use of ECD and integration across nutrition programming and pledges made. So what this means is that ECD is still not broken through in terms of programming, but also in terms of pledges. And so that means we have to do increased advocacy to ensure that not only country governments, but implementers, organizations understand how ECD is a critical, holistic approach to ensuring children have everything they need. Some of the other important critical highlights was that children in crises need increased prioritization. We're seeing most children actually who are suffering from malnutrition live in crisis settings and protracted conflict. And so this needs to be reflected both in investment and policy change. There is a leadership gap right now because there wasn't the level of commitment that was needed at N4G. And I know folks are still advocating for funding to go to nutrition, but there is a wider need for advocacy. And there is a critical window for influence right now as we can analyze these pledges and really zero in on things that will have high impact that we can work together on. So some of the very key gaps and barriers from this analysis, again, ECD was rarely explicit in the nutrition commitments. There was fragmented approaches across sectors and specifically in crisis settings, which we know limit overall health outcomes and outcomes for children in general. And then another thing that's important for this, and when we talk about ECD, was the limited specificity for age bands. So there was limited data disaggregation for the early years. So for ages 0 to 5 or 0 to 8, there was not a lot of specific information around those years. And we know giving nutrition in the early years leads to the best brain development, helps make sure vaccines are going to be uptake, and helps create early childhood education outcomes. So what can we do to kind of address this? And how can we build off of this information in the webinar today to really come up with some concrete recommendations and future next steps that will form a call to action that we can all rally around to make sure we're pushing this forward in our advocacy across contexts. So integrate ECD in all nutrition policies, and this is essential to maximize impact for children. We also need to prioritize the first 1,000 days in crisis settings, and of course, using disaggregated data so we can have an understanding. There was no inclusion of caregiver or mental health and well-being support throughout pledges made. So this is something that's really critical because we know the important role they play in ensuring children's lives are where they need to be. We need to strengthen cross-sector coordination across health, nutrition, protection, education. We're here to talk about that today. There needs to be an increased financing specifically for ECD and nutrition in emergencies, and we have to support locally led and community-based systems whenever we can. We do know that nutrition is one of the most cost-effective investments, and we know the critical role it can play for children in crises who don't necessarily have access to everything they need to strive and thrive. Within this analysis, I was also able to identify a couple of key governments that are primed for potential future impact. We know that the European Union has shown leadership in resilience, system strengthening, and large-scale multi-country investments. We know that Japan, who is the previous host of N4G, does have a strong focus on health and specifically nutrition, and even within the crisis context, explores disaster preparedness and human security. Germany is really interesting because the approaches that are multi-sectoral are spaces we can learn from. Norway continues to engage in education. And Canada, with Carney being elected last year, has maintained its investment in humanitarian financing, and we know that this is going to continue. Even last week, Canada was proud to announce funding for Lebanon in the humanitarian appeal. And we also know that Canada announced 78 million for the UNICEF Child Nutrition Fund to combat global child malnutrition at UNGA last year. Within the context of our advocacy, we've been working with Canada a lot on some of these policy changes, and we're thrilled to know that there is a lot of appetite for policy coherence across sectors, and also in trying to make sure that more folks are talking about different issues collectively. And that even goes for folks, for example, at Global Affairs Canada, having them talk to the nutrition folks, talk to the health folks, talk to the education folks, so we can have a better understanding of how to engage in this space. Why does this matter right now? And you're about to hear from three fantastic panelists who are going to give you their experience and really set the scene for the holistic approach. But we know that there's an increase of conflict, instability, and inequality in 2026, and we have shrinking aid across the world. We know that there's a need for more integrated approaches in crisis settings because right now issues are siloed and we have less financing. So we do need to be more efficient with our funding and how we're doing that on the ground. We need to have global advocacy that targets policy coherence across sectors and at different levels. And we need to champion ECD for better outcomes for children overall as the policy solution to address some of these issues. So with that, I'm actually going to be passing the floor to Katie Murphy, who is the interim director at Moving Minds Alliance, and she is going to start the panel discussion with our lovely advocates and experts before we dive into the breakout room activities. So over to you, Katie. Oh, you're just on mute.
Great. Thank you so much, Lindsay. An excellent introduction. I think you did a wonderful job really setting the scene and grounding us in why this issue is so important and why we're here together. So my name is Katie Murphy. I'm the interim director of the Moving Minds Alliance. The Moving Minds Alliance, for those of you who aren't familiar, is a global multi-stakeholder alliance of more than 40 organizations, all working together to ensure that young children affected by crisis and displacement receive the sustained, holistic support they need to thrive. We focus on the earliest years of life, from pregnancy through age 8, a critical window of opportunity, yet extreme vulnerability, when the right support can make a lasting difference. Our members span funders, civil society, humanitarian agencies, research institutions, regional ECD networks, and local and refugee-led networks and organizations across the globe, united by the belief that no child in crisis should be left behind. So I think Lindsay really highlighted why we're here today. In the 2025 Nutrition for Growth Summit, governments and partners made significant commitments to improve nutrition outcomes for children. And today's webinar is intended to build directly on those N4G commitments. We're particularly proud to be doing this together with Results Canada, a leader in global nutrition advocacy. And we have here with us today three exceptional speakers whose lived and professional experience speaks directly to what we're here to discuss. I also want to flag an important resource that we have that's very timely for today's conversation. Just last January, the Moving Minds Alliance published our triennial bulletin focused specifically on nutrition and ECD in crisis. So this is a very practical, member-led collection of insights, evidence, and emerging practice from across our alliance. And we'll post that resource in the chat for you to read and hopefully circulate. Now, it is my great pleasure to introduce our three speakers who I hope are able to turn on their cameras. I see Abdu, waiting to see Daria and Monica. But in the meantime, I will start introducing them. Great. I see Monica. I think if...
Yes.
Great. All right. So Monica Ivanche is a public health and program management professional with over a decade of experience across humanitarian and development settings. She's worked with the International Rescue Committee, Plan International, Doctors Without Borders, the U.S. Peace Corps, and currently serves as the regional field supervisor for the Global Fund project in Cameroon. She holds a master's in applied nutrition and is completing a PhD in public health. And she's the founder of the Nutrition and Sustainable Development Association. Abdu Shukr is a psychologist, refugee inclusion advisor, and dedicated advocate for the Rohingya community, and a genocide survivor himself. He began his career in nutrition programming with Action contre la Faim, focusing on child malnutrition, breastfeeding, and mental health and care practices. After fleeing Myanmar in 2017, he continued his work in Bangladesh with MSF and has since become a leading voice in the global Rohingya advocacy. He is currently completing a PhD and serves as a spokesperson for the Global Rohingya Student Union. Daria Merut is a Ukrainian youth advocate, communications professional, and co-chair of the Canadian International Education Policy Working Group. She spent 2.5 years with UNICEF Slovakia working on education, early childhood development, and programming for Ukrainian displaced learners, combining professional expertise with personal experience of displacement. It is a great pleasure to welcome you all. It looks like we're still perhaps waiting for Daria.
Daria just said that she just messaged me that she was having one Wi-Fi problem, but she should be on right shortly. And I think she's the third question. So we'll
Okay,
hopefully.
great. So we will kick it off. It is a great pleasure to have you all with us today. Thank you so much for joining. We will start with Monica. Why is nutrition so essential for early childhood development and health outcomes for children, mothers, and communities living in crisis settings? Would love to hear, based on your great breadth of experience and knowledge, your perspective on this. Over to you.
Thank you, Ketsi, for the question. So, just like Lindsay has mentioned, malnutrition is one of the leading causes of death in children under 5 years of age. And the first 1,000 days of life is a critical window period where children's brains develop, where their linear growth where their growth can really be linear, and also malnutrition helps in immune function. So for children in crisis settings, malnutrition is more critical, and if optimal nutrition is not maintained, they will have a problem with their brain development, they will have a problem with their immune function, and hence mortality or diseases, recurrent diseases, and they will also have a problem with linear growth. And this is why we have many stunted children in the crisis setting, and even out of crisis setting. We have many children falling sick because of low immunity. We have also many children who do not grow intellectually as they are supposed to grow. With respect to mothers, it is like a cycle. The nutrition of a mother affects the nutrition of a child. So when a mother is pregnant, if she is malnourished, she will have more pregnancy related complications. She will give birth to low birth weight. Her child will have low birth weight, and this low birth weight again can cause many health related complications. And also, she will have insufficient nutrients in her breast milk, which indirectly affects the child again. So she might not even have enough energy to breastfeed that child. So it's like a cycle. The nutrition of the mother indirectly affects the nutrition of the child. And for communities, especially in crisis settings, communities have already impacted negatively by the crisis. But malnutrition again affects their productivity. Imagine that children in crisis are intellectually deprived, and maybe mothers too are malnourished. All these people cannot produce at maximum. So it affects community productivity, and it strains further the health systems. In crisis, most health systems are impacted. So malnutrition strains further these health systems, and it strains the pockets of community members and the community as a whole. So financially, it's draining. The health system is overcrowded, and mostly in crisis setting, health systems are already overcrowded, and most health systems are closed in most of the crises that we have, especially crises related to war, flooding. Health systems are already impacted, so malnutrition strains more of these health services and even social services. So these are the impacts that the communities have. And it should be noted that malnutrition has a long-term development impact. whereby if a child is malnourished, the child's brain does not develop appropriately, that child does not perform well in school, the child will probably not perform well in life. So at a certain level, it affects the country as a whole, the community and the country as a whole. So it reduces productivity of this country. So for every dollar that is invested in each community, in each country, in the course of fighting malnutrition, it yields $23 in profits in developmental outcomes. So this is really very important. It is important. Evidence has showed that investing in malnutrition in crisis settings leads to better health outcomes, help the crisis to survive, help communities to survive crisis faster and to come out of crisis. So it is important to have malnutrition prevention programs, malnutrition treatment programs, supplementation programs, and integration programs. So holistic services, providing holistic services to children, looking at a child as a whole, and providing the services that each child needs to develop appropriately, even within a conflict situation, is very necessary for that community to come out of crisis and to reduce the impact of the crisis on the community as a whole and not only the child. Thank you.
Thank you so much. Excellent points. And I love how you really stress this need for more sort of holistic support, understanding the deep interlinkages between the mother and the child. And often this is very much at odds with the approach of the humanitarian sector, right? That focuses on very narrow, specific sectors and specific issues that it tries to address. So we really need to shift to this more sort of holistic longer term vision to ensure that children are able to thrive holistically. Excellent. I will now turn to Abdu. Abdu, can you give us a practical example from your experience in programming that highlights how holistic access to services through nutrition is impactful for children in crisis? Over to you, Abdu.
Okay, well, thank you so much for having me here. Yeah, in my late experience working with Action Against Hunger and Asia France in Myanmar, we saw firsthand that treating malnutrition with food alone is not enough. So we have to treat the whole child. So with we saw the first-hand treatment malnutrition was not enough. That's why we need to treat the whole child and caregiver. We implemented an integrated approach combining nutrition and mental health care practice. Before a child began nutritional treatment, we screen the caregiver and the caregiver for psychosocial distress. We realized that if a mother is overwhelmed by trauma, and the workload of the farm or the stress of displacement, she cannot effectively provide the nurturing care of infant message her child needs thrive. So our program combined medical nutrition with number one, psychosocial counseling for caregiver to build resilient and problem solving skill, and number two, play session and drawing art for children to provide cognitive stimulation and a sense of normalcy. And number three, practical demonstration on hygiene and balanced food, or the three group of food, by integrating this soft skill like teaching the value of play and parenting with hard nutritional intervention. So we did not just see children gain weight, but we saw them regain their curiosity and cognitive health. This holistic approach ensures the treatment stick because the home environment becomes a place of safety and stimulation. Yeah, thank you.
Excellent. And I love that practical example of the integration of MHPSS and nutrition for the holistic support. And I'm sure those who are joining us today and those who are not able to join us would love if you're able to share any further resources on that model, because that seems really exciting and something that we should be looking more deeply into. Thank you so much. So I will now turn to Daria. And Daria, we're so glad that you could join us today. As a youth leader, why do you believe Education, health, nutrition for children in crises must be seen as interconnected to policymakers, governments, and civil society. Over to you, Daria.
Thank you so much, Katie, and hello, everybody. I'm sorry for joining late. So let me start right away with your question, and I'm really glad that I'm representing today Refugee Education Council in this conversation. And being myself a refugee youth from Ukraine, I have seen clearly that children in crisis do not experience their needs in a sector. They experience them all at once, all together. Because when the child is displaced, they're not just missing school. They may also be hungry, they may also deal with trauma, they may also be separated from caregivers, they may also need have access to basic health care and so on and so forth. And if one of these needs is unmet, it directly affects all the others. And this is exactly what the nurturing care framework provided by WHO, UNICEF, and World Bank since 2018 is telling us that early childhood development depends on 5 interconnected elements, which is health, nutrition, responsible caregiving, safety and security, and early learning. And these are not separate interventions. They are one system, and we see this really clearly in emergencies. For example, on my country, Ukraine, that right now is in war, and since the full-scale invasion, millions of children have experienced simultaneous disruption across all the systems like education, health, services, protection. Many of children have been displaced multiple times. They lost access to stable schooling. They lost access to safety. They have to study in shelters and so on and so forth. So when we talk about education emergencies, we cannot treat it as a standalone solution, because a child who is hungry, he cannot or she cannot concentrate. A child experiencing trauma cannot fully engage in learning. And a child without safe and supportive environment cannot develop the foundational skills such as numeracy, literacy that they need. So unfortunately, despite the fact that we know this and we are all aware of this, I'm sure, our policies and funding structures are not based on these, and they are often fragmented. So we design education programs separately from nutrition or health, separately from protection. And talking from the refugee youth perspective, this simply does not reflect what is going on in the reality. What works is integrated approaches. For example, when schools or community centers become spaces where children can access meals, psychosocial supports, health services, and learning at the same time. Because if we want children not just to survive, but to thrive, we need to move these sector-based responses and approaches to child-centered systems, because a child is the whole, and it means that we need to integrate early childhood development as the foundation.
Excellent. So, and it really emphasizes how whatever sector you're coming from, and in your example, when you're thinking through the education programming, you have to look at the multi-sectoral lens, understanding how integration opportunities must be there and advocating for that to the donors and policymakers who have set up these systems that make it sometimes difficult to use that approach. Excellent. Great. So now we'll move back to Monica. And I would love to ask you, based on your experience, if you have ideas for promising programs, partnerships, or approaches that are emerging that successfully integrate holistic approaches to children in crisis, like ECD services. And importantly, how might these be scaled to a more global approach? Over to you.
Thank you. Okay, I'll just build on Zara's responses. I think we have already seen how important having the holistic approach. It is the same child that is malnourished. It is the same child that needs healthcare, that needs stimulation, that needs education. So we have already seen that, and there are several programs that have shown successful results, especially concerning these holistic approaches. I will just give a few examples. So, World Food Program in Sudan implemented their Go Baby Go program, which had a nutrition component combined with responsive caregiving play, and stimulation. And with this program, they realized that there was a 30% increase in recovery and up to a 13% reduction in length of stay. So children recovered faster and they stayed less in hospitals. This means that the children consume less RUTF, they strain the health workforce less, and this was very advantageous. IRC in Burkina Faso and in several other countries is implementing the Brighter Future approach, whereby they have a standard curriculum which trains mothers on stimulation, responsive caregiving, play, and even trains them on how to produce local tools. This approach is embedded in their nutrition programs. And with programs that have this approach embedded, they have realized that there is reduction in length of stay, there is improvement in recovery, and there is improvement in the number of children who relapsed. So you see that this is very important. This holistic and integrated approach is very important and very impactful, and it is cost saving. Again, we have other partnerships like UN agencies are partnering with UNICEF, WFP, WHO, and other INGOs and local NGOs are partnering in several settings with the integrated service hubs. These integrated service hubs have nutrition components, health components, treatment, prevention, vaccination, supplementation, social protection components, mental health, and everything in one space. Whereby when this child comes to each of these components, if the child is coming maybe with diarrhea, that child is assessed for diarrhea, sent to the wash partner, from the wash partner to the nutrition partner, from the nutrition partner, just so it goes round. It could be a social problem, it could be a caregiving problem, but it is the same child that has gone across all of these programs. And this has shown to be very effective in service uptake, because most times when we do referrals in different places, we realize that children don't get to the point where we refer them. But when the services are present, you see that these children service uptake is more and the impact of these services are better. So this is one other example. Another example that we can state is related to cash transfers and ECD programming, whereby at the point of delivery of cash, caregivers of children under 5 are trained on stimulation, they are trained on responsive caregiving, they are trained on parenting, and several other health aspects on how to take care of their children. These two have shown great impacts. So these are several programs that have shown in crisis settings that holistic approaches are not only cost effective, they are efficient, and they help to improve service uptake, and they help in recovery, and they reduce relapse. So we have other smart approaches which uses technology to send messages to parents on responsive caregiving. We have approaches that use telephone messages, reminders. We have door-to-door messages. There are several options that I think that each programming can, the uptake can really be good if programmers look at how and which option is best for their different programming options. So you can use soft ECG, meaning that low-cost ECG in nutrition programming. Use telephones, use text messages, teach community health workers on which messages they can teach mothers while they go for nutrition screening. In nutrition, in vaccination, include vaccination in nutrition programming. This is health and nutrition. So these are very cost-effective approaches, and they are very important, especially at this point where funding is a huge problem. And funders are constantly asking humanitarian organizations to show them the impact of every dollar that they are spending on them. Thank you.
Excellent points. And I think you touch on sort of the key advocacy messages that we have as an alliance when we're looking at in this environment of restricted funding, how can we really show that it is more cost effective and that it's higher impact, multiple dividends for the children, for the mother, for not just their nutrition, but for their long-term cognitive health and well-being Excellent, excellent points. And also so great to see these practical examples that can be scaled with a range of different modalities. So thank you so much for that. I'll turn back to you, Abdu, as an ECD expert and a refugee yourself. What would be your top recommendation to add into our global call to action? Over to you.
Well, thank you, Kitty, again. My top recommendation is to shift from providing for a refugee to partnering with refugee experts to effectively break the cycle of malnutrition and developmental delay. We must move beyond viewing refugees as mere beneficiaries of aid. We need to finalize the inclusion of refugee experts and community leaders in the design and delivery of programs. Because of our life experience, we understand the cultural nuances that led to challenges like why a caregiver might feel forced to sell rough or it's called a pumping to a shopkeeper, or why they might not understand the developmental value of playing in the sun. Therefore, my call to action is for global community to invest in the capacity of refugee professionals to lead this intervention. When you empower a refugee expert, you gain linguistic proficiency, cultural trust, and a sustainable impact that lasts long after an international NGO leaves. We don't just need more clinics, but we need more program designed and led by those who truly understand the heartbeat of the community. Yeah, this is what my recommendation for the international community.
Excellent. And that also is so core to the work of Moving Minds Alliance, where we're really trying to ensure that the voices and the expertise of refugees and displaced and affected populations themselves are leading the change, since we know that in order to ensure sustained impacts for children and families, it needs to be driven by that level of expertise and for those who are there and know the best. So thank you so much for that. We will now shift back to Daria. So Daria, why is it more important now than ever to ensure that children have access to holistic services in crises?
Yeah, thank you. Thank you so much for this question. And it's really sad actually to talk about it, but unfortunately, as you can see right now, today crises are not just short term. They are prolonged, they're complex, and they affect an entire childhood. So globally, 10 of millions of children are growing up in displacement, and many of them are spending not just months, but years. And sometimes the entire childhood. And this is really critical because, as you may know, around 90% brain development happens before the age of 5. So this means that whatever does happen or does not happen in the early years is going to shape everything: learning, health, emotional well-being, and future of the child. And the children who spent, let's say right now in Ukraine, it was 4th year of full invasion. So it's 4 years already of children spending these critical times in not protected and not safe areas, not growing and not developing right and healthy. So it is actually, it has the lifelong results on their lives. And unfortunately, it happens not just in Ukraine, but in many crises. So from Refugee Education Council's global survey that we did last year, we also saw that 94% of children experience displacement, and 56 of them are unaccompanied or separated from their caregivers. So this is critical because without parental care and protection, children face significantly higher risk of violence, exploitation, long-term psychological harm. And this is why we're talking here about the ECD, especially, and about early childhood development, because this is not just the place for the services. It's about protection, it's about prevention, it's about long-term recovery. And it is really important how my colleagues and other speakers already highlighted. This holistic approach is critical here, and it strengthens cognitive, emotional, physical development, especially in this first 1,000 days of life, which are the most critical for the child's future. So it creates the space for stability in unstable environments, which is extremely important in crises, because unfortunately when you live in crisis situation, every day for you is unstable environment, and especially for your body and for your health. So it builds resilience where there's already trauma, and this is why children who are supported early, they are more likely to grow into individuals who can rebuild and strengthen their communities from the crises before. So the urgency, I think, is really, really clear right now in the world. What we see is happening, and it is not just the response to crisis. We are trying to shape the future of the entire generations, because unfortunately right now we are living longer, more and more, longer and longer in the crisis situations.
Thank you so much, Daria. Those were excellent points, and I think everyone knows that we're in a very critical time in the world where conflicts and wars are raging, and where, as you've said, these issues and the circumstances that face children and families don't just go away when the bombing or the acute phase of the conflict ends. Often these are very long, protracted situations, and if we care about the future of our planet and our world, the need for early childhood development and holistic services could not be more urgent. Excellent points. Okay, I will now shift back to Monica and Daria, just to say we've heard from Abdu on his call to action in just one sentence, because we're going to wrap up and shift to the next part of this webinar. But what would be your call to action?
My call to action is directed to funders. I am calling on funders to invest in policies, in research programs, and in initiatives that support holistic approaches to nutrition and early childhood development in order to not only cut costs, but to improve efficiency. Thank you.
Great. And Daria?
Yeah, thank you so much. So my call to action and one thought that I really want you all to go away from this webinar with is that we must stop funding sectors, and we should start funding children by investing in integrated systems and deliver the support as whole, because children is the whole person, a human being, and we cannot deliver the support by sectors. Children experience crisis as one reality, and it's time that our systems finally respond as one. Thank you.
Great. Excellent points. I think I want to just give a round of applause first to our speakers for their very fascinating and poignant and timely reflections on the situation for young children and families in crisis settings, and providing very practical experiences based on their own work and their expertise on how we can move forward in prioritizing holistic services for young children, integrating ECD and nutrition. So really commend you for being here today and for sharing those perspectives. Thank you. I think we can move now to questions.
So we have one right in the chat to kick
Okay.
things off, and we can take a couple questions before we dive into the breakout rooms. So the first question comes from Suzanne. Generally speaking, international coordination mechanisms in crisis settings are siloed and not multi-sectoral. How can we work around that in the short term and change the system in the long term? I think that's a great question, because that's part of the conversation we're trying to have at this moment, is bringing all these different folks together, hearing from amazing diverse perspectives and trying to figure out what we can do. But I want to open that question up to the three panelists. I'm not sure if Daria, Manika, or Abdu, if either of you want to kick things off. Not everybody has to answer either. You can have a second to think.
Okay. I think in the short term, what we can do is to, first of all, create referral pathways that are active. So making sure that in every sector, every partners do not, our programming can be siloed, but partners should not operate in silos. So partners should operate in consortia, in they should have pathways where they can refer cases, and each partner should be able to understand the holistic child. So an understanding of the holistic child helps the partner to know where to refer the child to and to whom the child can be referred to. So I think that this is one of the approaches that we can use. And the second approach is to strengthen community systems. So we have partners that are operating in communities that are mainly not their communities. And most of these communities have existing systems that can provide these multi-sectorial services. But if we do not strengthen these systems, it is going to be very difficult for these communities to provide the services that partners cannot provide. So looking at localization can help a lot, strengthening systems and having referral pathways. I think those are important aspects in the short term to make sure that the multisectoriality of humanitarian response is really respected. Thank you.
Thanks for that. And we're going to continue this conversation in the breakout rooms right now. I'm actually going to launch breakout rooms. So this is the part where we are going to be really engaging with folks on the call. You're going to be put out into breakout rooms with facilitators from the MMA and Results Canada staff to answer a question. And you'll have 20 minutes to explore this question to try to really get some recommendations and feedback and some policy solutions or some calls to action that we can move forward as a collective. So we're actually going to get kick-started with question one. So group number one answered the question, what specific policy or financing actions should governments and donors take to better support integrated nutrition and ECD services for young children in crises? So I want to pass it over to the note taker or the report back from number one to share the initial conversation.
Yeah, Sarah, I don't know, because you were taking notes, maybe you would like to share quickly what we spoke about.
Yes, I'm happy to do that. So we had a couple of adages come out, which was really nice. So the first one was we treasure what we measure. So there's an element to ensure that there is requirement for outcomes and indicators that relate to, yes, growth and nutrition, but also that integrate child well-being and mental health indicators as well. So that was kind of the first recommendation. I'm also just going to go through these really quickly. I have detailed notes, but and the second recommendation was around having kind of sustainable funding and creating a mechanism that implicates and includes communities directly and working together with that the community should be seen as critical stakeholders, and that these stakeholders should there should be integrated into policies capacity building for these people in order to have better responses there. There was something. In addition to that, it was indicated that in the policy and financing actions, they should create an intentional partnership with communities in grassroots and state level so they can be a partner in creating a multi-sectoral approach rather than from top down or otherwise, or, outdated and ineffective mechanisms that can currently exist. There was a suggestion that there should be more, and of course these were contextualized within Bangladesh, Kenya, and Nigeria, so I'm trying to bring it up to what could be applicable everywhere. But there should be a focus on research and policy making to develop integrated strategies. And then for specifically within like refugee camps in host countries that are not keen to keep the refugee population in there, that it should be kind of a conditional with donors and funders to ensure that supports are provided for refugee communities in camps instead of just, governments hosting and giving money and then waiting for people to leave, essentially, especially in situations where they can't go back. Then there was another adage that I really loved was that if it's not written, it will not be done. So this means that really putting it into the policies to say that they need to develop kind of emergency chapters within their policy to make sure that it's not a surprise if crisis happens. So policies are usually developed, things are going to be okay, but rarely there is a focus on if crisis or emergency happens. So that was one of the big policy recommendations as well. And within that, it should be important to include refugees as well as collectively develop this work. And finally, it was suggested that there should be an accountability mechanism at multiple levels to ensure that what the commitments are actually being completed. And then finally, there was through the work that MMA is doing, and I'm with MMA. There was a suggestion around pooled funding for ECD and crisis, and that would be kind of a holistic and multi-sectoral approach that would bring together, funders, donors, NGOs, and governments, so that you would have this money kind of set aside. I hope that was representative of what we discussed in the group.
Awesome. I think that's a great start, and nice to see some thumbs up from folks in the audience and some head nods. I think that's a really good example of some of the things that we can take forward. So question number 2. So whoever was in group 2, get ready. But what practical approaches can strengthen intersectoral programming so that nutrition services and crises also support early childhood development? So over to you, group number 2.
I think I will be speaking from group number 2 because some of our members had to leave, unfortunately, but I was keeping the notes. So let me start with we also have discussed a lot of things, and firstly is the financing and the systems that needs to be shifted towards integrated approaches, kind of what the group 1 told us already about, but things like being able just to create, for example, the coalition of funders with the approach that is based on one child. So this was a really practical solution that was suggested. Also, we discussed several practical ways how to integrate the services on the ground. So, for example, it includes embedding ECD into already existing nutrition platforms. So, for example, combining nutrition screening with vaccination, early learning, or responsive caregiving, etc. We also were talking about the importance of cross-skilled workforce, community engagement, and also one point that was raised is the lack of data and evidence, and the need to create more research and evidence-based solutions. So, and another thing is also MHPSS and mental health support for caregivers and for mothers especially. I mean, there is so much more, but I think this is overall, right?
Yeah. Thank you so much. And I think it's interesting too to see already the thread of mental health and caregivers, which was largely missing from a lot of even the N4G pledges as a consideration or something built into the programming there. So definitely a space for advocacy. So the next question was facilitated by my colleague in group 3, Reed, and I have to do this because it's his birthday today. So I just want to say happy birthday to Reed. But the question group 3 focused on was what changes to humanitarian or development coordination mechanisms could better support integrated nutrition and ECD responses for young children in crises. So really diving into the systems aspect of the question. So who from group 3 will be sharing some of the remarks you discussed?
Suzanne Zeidema, and I'm sharing. And Reed did not mention it was his birthday, so happy birthday. We had three ideas related to how coordination mechanisms work. The first one was to allow for more opportunity for personnel across multi-sectoral organizations to engage. Within multi-sectoral organizations, they tend to work together, but there's not a lot of opportunity because of the siloed structure of coordination mechanisms to go outside of your sector. So that was one. And then alternatively, we had this idea that we've just accepted in crises that the coordination mechanisms like the UN cluster system is done by sector, but what if it weren't? What if it were done, for example, by age group? So anyone working in birth to 8, for example, regardless of sector, you are in the same coordination body. So we thought that might help just lend itself to multi, different sectors working together on the same issues. And if your organization works across the lifespan, then you work in all of those. But at least like birth to 8 or school age or youth, they would be coordinating across sectors because they would be working together. And then the last one was a change to coordination mechanisms to support the referral process for young children. So that, regardless of what part of ECD you're working on, the larger coordination mechanism has helped design and support the referral process. So to make sure that children can get whatever they need smoothly. That's it for group 3.
Fantastic, group 3. Really like that idea of changing it not by issue but by age group. I think that is a very unique idea, and it would probably take a lot of advocacy to do that, but I think that it could be like a very important approach or consideration when we're thinking about this. So thank you so much, Suzanne, for sharing that. And the last group, so group number 4, the question was, what practical recommendations could help ensure children in their early years in crises have access to holistic services that support their development, including nutrition, health protection, and early learning? And so this speaks more to kind of the broad, what can we do right now? And I'll pass it over to whoever is speaking from group 4.
Thank you. That would be me. I'm Ramila Karnati. I was a former senior director with early childhood at Save the Children. I'm representing our group, and I want to acknowledge Gabrielle's really good note-taking from Results Development Canada. Thank you. Thank you. And I really hope I do justice to your notes. So I want to build on what Suzanne said, because it came up in our group too, that a key point is to strengthen those referral pathways between the sectors. And I know it came up in the group discussion too. So I think that is a great point. Another point that we focused on was on the funding. How the funding proposals should be multi-sectoral. So putting that emphasis on philanthropy, on that funder, so that the mechanisms exist for multi-sectoral collaboration at that funding level. What we spent a lot of time discussing was when there is this increased willingness to collaborate between sectors, but if it's not reflected at that funding level, then we are still continuing to report back and deliver only per sector. So much education is needed at that level of philanthropy. So we could then get around a mechanism that supports collaboration at the funding level. I want to also say another point that we really briefed on was like looking at behavioral insights to bring about changes in behavior, whether that's at that philanthropy level or at the collaboration level, to see what would make that change in behavior happen. And some of the practical recommendations, which were most interesting, is this encouraging of funders to start opening up communication channels so that folks can really look at what it brings them, what funding can bring when they work together. So looking at funding pledges, because that's when accountability happens. So those were some of the points that were practical, doable actions around funding from a multi-sectoral perspective. Another point that we considered was a lot of money is given to the hands of a few. But what would be more practical would have smaller grants which is like, and diversify that funding so that encourages more collaboration. It is also more sustainable when it's done that way and less concentration of funding in the hands of a few. And finally, a really practical step is when stakeholders across sectors come together, whether it's these stakeholder meetings between the health, the nutrition, protections, climate, education, all of them coming around the table. Once every quarter at a frequent cadence really brings about practical ways where we can work together. Thank you. And Shari, if you want to add. Thanks. That is what we discussed from group 4.
No, thank you so much. And I think already seeing some duplication across is really great because these are going to inform kind of the recommendations that we're going to be building and sharing, not only with the folks on this call, but also in other sectors as well. So this is just the start of a process where we're going to be hoping to really build some impact towards making change on some of these issues because we know that holistic access is what's needed. We are just about at time. So I'm going to pass it over to Katie to give some closing remarks. But I also first wanted to quickly see if folks wanted to come off camera to take a picture quickly before we wrap up, because I think this has been an excellent call and start to the conversation that we're going to be engaging with. So if you'd like to come off, to come on video, we'll do a quick photo, and then I'll pass it over to Katie for the last final remarks. So just one second. Okay, so I see some videos coming off right now. Okay, ready? 3, 2, 1. Awesome. Thank you so much, everyone. And over to Katie for some closing remarks.
Thank you so much. And I won't keep everyone much longer, but this has been an excellent discussion. Really appreciate everyone's contributions and so great to see your faces. Hi, Edward. Glad that you just popped on. Old friends and new friends. It's been really wonderful that we had both kind of the high level perspectives from those with lived and practical experience from our excellent panelists. And then we had the opportunity to really roll up our sleeves and think through how we could dig into these questions and come up with practical recommendations. I hope each of you thinks about how you can take the efforts that we've collected here today and the recommendations that we've gathered to think through how that may apply to your own context, to your own government, to your own challenge, and that we continue this conversation. This is just another step in a longer trajectory that started a while before, started long before N4G, and now we're kind of hoping to continue this momentum, building up towards what should be lasting and sustained change for young children and families living in crisis contexts. So we welcome your ideas. We welcome your engagement in the Moving Minds Alliance. Please reach out to us and let's keep this momentum going. We are delighted to have you all here today, and we hope that we can all come back together again in the near future. So thank you again, and we look forward to future discussions.